I'm Darryll Gaskin. I'm an associate professor of health economics in the Department of African American Studies, and I've been on the faculty since January of '07, so it'll be 3 years in this January. Prior to coming to Maryland, I was at Johns Hopkins, the Bloomberg School of Public Health in their Department of Health Policy and Management, and prior to that I was at Georgetown University.
Tell me a little bit about the research that you're doing here at Maryland.
Well, my research primarily focuses on three factors. One is access to care for vulnerable populations. The other is safety net hospitals and how they provide care and how we subsidize the care that they provide. And then the third is health care and health disparities. My work primarily right now focuses on that third aspect, and I have a pretty good project going on right now looking at how racial segregation influences disparities in healthcare utilization.
And what are you finding in that research so far?
Well, what we're finding is that where you live matters. And to the extent that if you live in a community that doesn't have a lot of physicians there, doesn't have a lot of healthcare resources, then you're going to have fewer physician visits during the year. You're going to have more emergency room visits during the year, and your access to overall health care is somewhat limited. And that some of the differences that we see with respect to differences between whites and blacks is due not so much to race per se, but more due to where you live and the resources that are available where you live.
So if you lived in inner city Baltimore, you likely have less opportunity to get good health care than you would if you lived in Bethesda or
Right.
in somewhere outside of Chicago, say.
That's absolutely correct. Or if you live in inner city Baltimore, instead of having a primary care doc whose office you would go visit, the next best available care is usually the emergency room. Or if you're fortunate and that there's a community health center available, then you can go to a community health center. But those are well, I wouldn't say few and far between, but they're not as well funded as say the private physician who's operating in a fairly even affluent middle class communities. And so those when we look in our national data and we see these differences, there are some ways in which we can mitigate those differences if we just think about how to improve geographic access to care.
Where do you hope that your research takes us? What do you hope the end game is on it?
Well, I really care about what happens to poor people. So even my inquiries into safety net hospitals and my inquiries into healthcare disparities are fueled by this desire to make sure that the poor in our society have access to health care and a healthy environment to live in.